Hi, my name is Dr. Stephanie Saucier, and I'm a board-certified cardiologist. And today we're going to be talking about recovery after a CABG. So let's dive in. If you want to learn more, click the link below and go download my free heart health guide. What's the timeline look like for someone following a CABG surgery? Well, initially, we're going to be worried about wound healing and really the acute process. This is after you get out of the hospital, where we've deemed that it's safe for you to go home. Now we're going to make sure we look at the sternal wound, make sure that there's no signs of infection, if sutures need to come out, or if everything's internal, letting that heal and recover. This is going to require you not to be driving until you get the okay from your surgeon. Often, people are allowed to start driving 4 to 6 weeks after surgery. And again, it's because that sternum has been cut and it needs to start to heal. We also want you to start participating in cardiac rehabilitation and getting that stamina back up, which we'll talk about in a couple minutes as well. Now, typically, full recovery from CABG surgery usually occurs by about 12 weeks post-operatively, where you're back to doing things that you want to do and kind of normal day-to-day life. What should you expect immediately after a CABG? So let's talk about the in-hospital setting. So typically, right after your surgery, you will be in an intensive care unit. You often will still have an endotracheal tube or a breathing tube that's helping you breathe. And you will also have a lot of wires as well as some chest tubes that are coming out of your chest. Now, right away, we try to get that breathing tube out. So within 6 hours, our goal is to have your breathing tube out and you awake and breathing all on your own. That's the goal. Now, things may or may not change. Once we get that part done, then you're going to be monitored for any drainage from your chest tubes. And as soon as the drainage is minimal, they'll remove those chest tubes. We're going to want to get you up and moving and walking pretty quickly after your surgery, either same day or the next day. There's going to be adjustment of medications. We're going to be watching your heart rhythm the whole time to make sure that you don't go into any arrhythmias or irregular heart rhythms. And patients often end up staying in the hospital. So from the intensive care unit, you often go to a step-down unit, and then you go to a medical floor. Those are all the steps leading out of the hospital. And so once someone is discharged, it usually takes anywhere from 3 to 7 days post-operatively for you to be well enough after a CABG to go home. What about the recovery time immediately after going home? So let's say you're 7 days after surgery, you just got home. What does that look like? It's important that we're watching the wound, okay? So your surgical incision, to make sure that you're healing well, there's no signs of infection, that your blood pressure is well controlled, you're on appropriate medications to help protect your surgery and to protect your heart. That's really in the immediate post-op period, okay? So that like 1 week time frame. Then in your 2 to 4 week time frame, we want you being active, moving around gently, of course, okay? Again, management of blood pressure, cholesterol, plus or minus blood thinners if needed. All of these things will be determined by your doctors. Now, we also want someone to start cardiac rehabilitation. This usually occurs in that around 6 week time frame. So between 4 and 6 weeks, we want you to start with cardiac rehabilitation, which we'll talk a little bit about more what that means as we go on. Now, complete recovery, where you're back to your close to your normal, usually occurs around that 3-month mark. And so you should be getting back to your day-to-day life. Again, taking appropriate medications, staying active, working with cardiac rehab or completing cardiac rehab at that point. And then after that, we consider you more of your long-term post-CABG follow-up. Now, during all of this time, you may have additional imaging done, such as echocardiograms. And post-operatively, more than a year out, what we want you to do is we want to watch for any signs and symptoms of changes in your symptoms. So making sure all the grafts are open, making sure controlling blood pressure, again, cholesterol, staying active, living a healthy lifestyle, a diet, exercise, all of these things are really important to protecting those grafts, especially not smoking, controlling your diabetes if you have diabetes. So in the long term, everyone's bypass grafts last a little bit of a different length of time. However, if you treat your heart well and follow a heart healthy recommendations by your doctors and take your medications appropriately, then hopefully your grafts will live with you for the remainder of your life long term. So that is a little bit of the timeline from the acute phase in the hospital all the way up to the long-term post-op after CABG. What does the medication management look like post-CABG? Well, things that are going to be really important are blood pressure medications, cholesterol-lowering medications, plus or minus aspirin, and if you had irregular heart rhythms, maybe a blood thinning medication. But those are going to be the most important medications that we're titrating and changing in the post-op period, and that's both acutely and long-term. And so those are medicines that we're going to use to help protect your heart, help protect you from having any more blockages, and keeping those bypass grafts open. That's our key. Now, I mentioned cardiac rehabilitation a little bit. So what is cardiac rehabilitation? Cardiac rehabilitation is imperative for all people who undergo open heart surgery or bypass surgery. In fact, research has shown that people who complete all sessions of cardiac rehab actually live longer. Cardiac rehab is a tailored program in the presence of exercise physiologists and nurses, as well as being monitored to get you back to exercising. Now, we use the Borg scale, and kind of just a modified Borg scale would be getting to a target of like a moderate intensity exercise would be our goal. Now, starting with a 1 being no intensity versus 10 being the most intense exercise you've ever done, we're shooting for that middle ground. We're shooting for kind of that moderate intensity, and you'll work up to that in cardiac rehabilitation. That's kind of just an oversimplified view. Typically, cardiac rehabilitation lasts 3 days a week. Usually they're 1-hour sessions for about 12 weeks. Now, this can change based on your work schedule or other things, but that's the standard cardiac rehabilitation setup. And again, people who complete cardiac rehab live longer. So we really encourage everyone who has surgery to finish their cardiac rehabilitation and get back to being strong, active people that they were before their surgery. A lot of times patients say, well, I'm scared about life after CABG, and I tell them that this is exciting because the reason why they might not have felt good or had been fatigued or difficulty breathing or chest pain prior to their CABG was because of those blockages. And now post-operatively, you have all this extra blood flow to the muscle of your heart. And hopefully that's going to 1, make your heart stronger, 2, take away some of those symptoms, and 3, get you back to doing the things that you love to do, whether that be playing with your grandkids, golfing, playing tennis or pickleball, or kind of anything that you love. So I always encourage patients that oftentimes if we're recommending bypass surgery or CABG, it's only to make your life after CABG that much better.